This microphone's not. Is it on now? It is. Good. Okay, so you can hear me well. My name's Kathy Stienstra. I am the chair of the board of the nonprofit Maple Center, and I'm a physician with the Maple Center for Integrative Health, and our practice name is Integrative Roots. I've been practicing for 40 years, so I've had a chance to see a lot. And one of the things that comes up very commonly in sessions with people is the whole issue of sexual health. So I'm pleased to be able to share some tidbits with you along those lines this morning. We are going to talk about our amazing bodies and what to do when they're not so amazing. So my plan is to review sexual anatomy and physiology, talk about hormonal effects and treatments, common challenges and treatment approaches, specifically for libido, sex drive issues, arousal, orgasm, comes too soon, comes too late. And then I just want to say that I have respect for the very many ways that humans express sexuality. And that while I'm going to be talking a lot about male and female, I hope that this will be inclusive for all people who are listening. So I'm going to start with female anatomy. External genitalia, or vulva, are the medical terms that include the mons pubis, the little fatty bulge that we have over the pubic area, the clitoris, the labia majora and minora. Is my cursor showing up there? It's not. So the labia minora are the small lips on either side of the vaginal opening in the urethra that don't have hair. The labia majora do. And then there are glands that provide lubrication on either side of the female genitalia. There's the Bartholin glands, which are the bigger glands that sit at the bottom of the vaginal opening, and the Skene's glands, which hug the urethra, the opening to the bladder, which is above the vagina, and that release fluid that lubricates, particularly with orgasm, that may play a role in preventing urinary tract infections. And you may have heard of female ejaculate, sometimes called squirting. About a third of women have these glands, and with orgasm will actually eject some fluid. The clitoris is the only organ that is made explicitly for sexual pleasure. It has no other function. And it has a much bigger structure than most people realize. So people are very familiar with the little tip of the clitoris that's very sensitive, just at the top of the labia, but it has erectile tissues that connect to it that extend internally. So there's a pair that sort of hug around the vaginal opening, and then there's a pair that extends down onto the pelvic floor, so that there is surprising amount of anatomy related to the clitoris. This is the artist from Sydney, Australia, who thinks this is something that needs to be spread far and wide, and who's made a 100-to-1 model of the human clitoris. Kind of fun. So internally, that you can see in this picture at the bottom, those two arms that are spreading out into the pelvis, and then the wraparound, more rounded parts of erectile tissue. The vagina extends internally. The uterine cervix dips down into the vagina. The uterus itself is pretty mobile. In some women, it leans forward, some it leans back. It can move around quite a bit. There's a round ligament that hooks onto the uterus and wraps up and around and down into this lower part of the pelvic floor. So all of these sex organs are very connected from an anatomical point of view. So erectile tissue is present in women as well as men. And this is, I hope I'm giving you some insights into what happens in your own body. But there's a collection of blood vessels, and a big part of this is that clitoris, erectile tissue, but there's erectile tissue in the labia, and the uterus itself becomes erect with sexual arousal. Now, you've heard of the G-spot. So what is the G-spot? And people have tried to answer this question, and it's not really clear. There's a lot of debate, but it is an area on the front side of the vagina that is erogenous. It's sexually pleasurable for many people. It probably is where these wings of erectile tissue from the clitoris come together around the vagina. The way you find it is you insert a finger with the palm side up a couple of inches, and then you do a come hither sort of move with your finger when a person is sexually aroused and that erectile tissue is ready to go. And if it's pleasurable, you've found your G-spot. There's a website here that's on the handout. And I don't know if you saw the handouts when you came in, but if you want more detailed instructions, that website will help you. Now, male anatomy, we have external genitalia is again the medical term for the package. The penis has erectile tissues that run in tubes. So you can see in the picture up on the top left that there are two round areas that extend down through the penis, but also down into the pelvis. So that when an erection occurs, it's not just on the outside part, but it extends down into the pelvis. These are called the corpus cavernosa, and there's also a round cylinder of erectile tissue that surrounds the urethra. And so what happens is when a man gets aroused, the muscles shift and the blood flow into the penis, the inflow is fine, but the outflow gets blocked. And so then it becomes firm with that extra blood within it. And you can see on these bottom pictures what the blood vessels look like when they're small versus when they're engorged. The length of an average erect human penis is 5.2 inches. That means half of men are longer, half of men are shorter. But there's this myth that everybody's got a longer penis than I do, right? And so I just want to put that to rest. Excuse me. The male G-spot is the prostate. So that is one of the reasons why anal stimulation is very pleasurable for some men, because the prostate is just right against the rectal wall. And so that can be pleasurable from a stimulation point of view as well. And we have this amazing complex of nerves that make all of this work. Have to grab it. A sip of water, I think. So the pelvic floor is amazingly complex. And all of these muscles play a role in pelvic floor wellness and in the sexual response. The arousal cycle, when a person is enjoying sexual activity, starts with desire, libido, or called sexual appetite. Something gets you a little stirred up. And then the excitement phase and the plateau phase is when a person begins to do sexual activity. That then leads to orgasm and then resolution, or referred to as sexual satiety. So in women, what happens in the body during those different phases is really, again, quite complex and quite remarkable. The vagina lengthens, the vagina excretes fluid, that's a lubricant. The clitoris expands and becomes erect. Dopamine, which is a pleasure neurotransmitter, increases, pupils dilate, skin can flush, nipples can harden and become erect. And then during that activity phase of plateau or arousal, heart rate picks up, blood pressure will increase, the lower vagina swells a little bit more, the clitoris becomes more sensitive and might even withdraw a little bit. This is what makes it challenging sometimes for partners, is that there are times when the clitoris is super sensitive and times when it isn't. So communication is important. The Bartholin glands produce more lubrication, muscles tighten, abdominal back, all over the place. Things will automatically firm up. The pelvic floor muscles tighten, reducing the diameter of the vaginal wall. And then with orgasm, there is a rhythmic contraction that occurs. There's this buildup of nervous tension that then releases, and the uterus contracts. If you're pregnant, you can feel when you orgasm that the uterus contracts a few times. The vagina, the pelvic floor, the anus, the clitoris, and there's this big whoosh of neurochemicals that happens. Oxytocin, dopamine, serotonin. People make involuntary sounds. There's movement. Sometimes there's eye rolls. There's flushing of the skin, forceful letting the breath out, toe curls, and a sense of release of stress. And in some, female ejaculation. And resolution can be fast or slow. Vital signs come back to normal. Person feels relief, satisfaction, and sometimes fatigue. Men's sexual response is similar but different. In that excitement or desire phase, blood flow to the genitals increases, causing a partial or full erection. The same muscle tension. The testicles may swell. The scrotum may tighten. There can be a little bit of lubricating liquid secreted from the tip of the penis. Those same neurochemicals happen. During the plateau phase, similar, but the erection gets more firm. The muscles at the base of the penis may contract, testicles pull up a little bit more, and muscle spasms can happen. And then with orgasm, there's also ejaculation in addition to all of those muscles contracting with the release of what's called semen. Otherwise very similar to what I described earlier. Again, resolution can be fast or slow, the erection resolves, vital signs normalize, but men have a refractory period that's different than the refractory period that women have. Or women don't have a refractory period. There can be several minutes to hours where a man may be incapable of having an erection, but women can have multiple orgasms. Not that everybody does, and this doesn't happen every time for every woman, but there is a physiological difference. So these charts, the top one is the male variations of what can happen in sexual arousal and response with the excitement phase, the plateau, the orgasm, and then the resolution. With the refractory period when it finishes, depending on how long the refractory period is. And that varies a lot from man to man. And as one gets older, it tends to go longer. But there can be then again another arousal phase with orgasm. Sometimes people will have reaching a plateau where they have these sort of little waves of pleasure, and then it resolves. And it's not that dramatic orgasm that can occur, but is also another very normal and common experience. And that those can happen for women as well, but you can see that there's not the refractory period and that a woman can then have another orgasm phase or more than another one. Now, is sex always about orgasm? Of course not. You know, sex is about connection and pleasure and excitement and skin-to-skin contact and building trust and sharing experience, having fun and being present with each other, and so much more than that. It's very complex, and I'm not trying to distill it down into medical terms. I do want to talk about hormones, which are a pretty important part of our body's sexual response. We're not very sexual until we go through puberty and we start to have these secondary sex hormones. Girls start to have menstrual cycles. During that fertile period of the menstrual cycle, our body is really trying to get us interested. It wants us to have children. And so testosterone comes up as all the ovulatory hormones do, and that increases sex drive. All of the secretions that are being made by the cervix, et cetera, are all designed to try to help get you interested and get you pregnant. And the things that then can affect this is when women have their ovaries removed with a surgery, or when a woman goes through menopause, she may have a decline in her testosterone production from the ovaries at that time. She may find that her estrogen goes down, but her testosterone is relatively stronger and her sex drive gets better at menopause, but that's very individual. If you have a medical condition that affects your blood supply or affects your nerve functioning or affects your ability for the brain to send out signals to the gonads in order to make things happen, those can all play a role in sex drive and sexual functioning. For men and women, if the testosterone or another hormone called DHEA, which comes from the gonads but also comes from the adrenal, if they're low, there's a lot of symptoms that might make you think that that's part of what's happening. Person may have extra fatigue, hot flashes, night sweats, loss of that sex drive or interest, not as strong muscles, bone loss, erectile dysfunction, mood changes. Depression can be one of the ways that testosterone deficiency presents. And too much androgen, too much testosterone or DHEA can make you oily and irritable and cause acne, and aggressive feelings as well. I've had patients who have said, I don't really like the way I feel with this support of hormones because I just feel aggressive and irritable, and I don't want to feel that way. So it's a very individual thing. The hypothalamus sits above the pituitary in the middle of the brain. And the hypothalamus and pituitary are what send down the hormonal signals to the ovaries or the testicles to make the hormones. If there's not enough, they go up. And that's one of the things we can measure with blood tests to look to see if a person is having issues. If you have a lack of libido or sexual challenges like erectile dysfunction, it certainly could be related to not having adequate levels of the right hormone. And there's a ton of reasons why that can happen, not to mention environmental toxicity in today's world. But if you're talking to your provider about looking to see are hormones playing a role in this issue for me, these are the blood tests that I would recommend. The total and free testosterone are protein bound and non-protein bound. Luteinizing hormone is that pituitary hormone that sends the signal down to the ovaries or testicles. Prolactin is a hormone that the pituitary makes that can be overproduced and interfere with sexual functioning. DHEA sulfate I mentioned, I've got the numbers of what I would consider to be normal, some are optimal. Sometimes my optimals or integrative medicine optimals are different than lab normals. In total estrogen can be an issue. If a man is making too much estrogen, that can interfere with sexual functioning. So a total estrogen should be less than 100 in men. And for women, one of the questions is if she's reproductive age, is she ovulating well and then making progesterone the second half of the cycle? Because that plays an important role in the production of the androgens, which include testosterone and DHEA. So for many people, one of the problems with too much estrogen, men and women, is that we have extra adipose tissue or fatty tissue, and that has an enzyme in it called aromatase, which will take our testosterone and convert it to estrogen. So that's when men start to grow breasts because they have so much estrogen around. So how do we help with that? Well, ideally we reduce any excess fatty levels that we have, so weight loss can be helpful. Improving insulin resistance is helpful. There's an interaction biochemically with that. There are medicines that will block that enzyme called aromatase. So from a natural medicine point of view, chrysin is one of the best that's out there. But from a prescription point of view, if I have patients for whom we're using testosterone supplementation, we use Arimidex, which is a prescription at little tiny doses. It's designed for women who have breast cancer, not to make estrogen from their fat cells, but it works really well for men who have excess estrogen. So this is not our goal. But with men who have reduced testosterone production and it's coming from the pituitary not quite doing its job, rather than giving testosterone directly, we can use a prescription medicine called Clomid, and it will stimulate the pituitary to make those signalers that get the testicles to make testosterone better. And for a young man for whom fertility is important, then this is a better choice, because when you supplement testosterone, it will shut down some of the sperm production. You can cause a little shrinkage of the testicles. It can cause thickening of red blood cells. All these things are monitored if a person is having testosterone supplementation. I would say it works 90% of the time. There are some men for whom it doesn't work, and it takes a little longer than directly starting testosterone. The goal with testosterone supplementation is physiologic replacement. The extra amount of testosterone that's being used in some circumstances is really not healthy for your body. For men, before you would start a testosterone supplement, you'd want to make sure that you don't have prostate cancer, because it will fuel the growth of that prostate cancer. There's no evidence that testosterone supplementation causes prostate cancer. In fact, estrogen is probably more likely to be a risk factor for that. But there are some significant issues that's important to monitor if you're using testosterone supplements. DHEA, on the other hand, is over the counter. For men, these would be the starting doses I would recommend. The adrenal glands take you down through this cascade of different hormones, and you can see that DHEA gets turned into testosterone. There are a lot of supplements that are sold to support libido and sex drive. I'm not going to read these to you. They're on the handout that I've given you, but they can all have some benefit. I think the most fun name here is the horny goat weed. Increasing testosterone, being healthy overall, is part of what helps that hormonal part of the body work as well. So taking care of yourself in all of these other ways is an important aspect to hormonal health. I will say that xenoestrogens from plastics are probably one of the reasons we have an epidemic of low T. And mold toxicity, which is one of the areas that I really include in my practice, is a more common cause for pituitary not functioning well than most people realize. In women who aren't ovulating and making progesterone, just supplying that missing hormone can help the body to make testosterone as well. So, and in menopause, progesterone alone not only helps support testosterone production, but it helps with hot flashes, vaginal dryness, and it has no increased risk of breast cancer associated with its use. You can use bioidentical progesterone, and I emphasize that because the synthetics, the non-bioidentical synthetics, will not work in that cascade of making other hormones. But you can buy 20 milligram per gram progesterone over the counter. You can take it orally as a prescription called Prometrium. There's peanut oil in it, so if you're sensitive to peanuts, it's not a good choice. But then the compounding pharmacies can make a wide array of both oral and skin cream options. So the synthetic progestins to avoid are the medroxyprogesterone and norethindrone. In menopause, when the estrogen levels drop, the tissues around the vaginal opening are very estrogen sensitive, so they become thinner and less stretchy. They don't lubricate as well, and it's why intercourse can sometimes become painful. If the testosterone drops as well, sex drive can reduce. And so the treatment for that is, again, lots of different things to help support your health. Staying sexually active, using those tissues helps them be supple and thicker, but hormones can really be very helpful. These are non-hormonal supplements that a person can use. And again, I'm not going to read them to you, but there are lots and lots of options to help. And then there's compounded bioidentical hormones. And we have 3 forms of estrogen, E1, E2, and E3. I love E3 for topical vaginal support because it doesn't stimulate the lining of the uterus or the breast compared to E1 and 2. So it's very safe, but the vagina and the bladder love it. And so you get this wonderful thickening of the tissues. We can use natural progesterone creams, as I mentioned, and testosterone and DHA can be added to a ton of different products. These are my bioidentical favorites. There's a prescription E2 patch that works well for many women. Prometrium is the pill I mentioned, and then all of those compounded effects. E3 can be used as a little vaginal insert, plus minus testosterone if a woman needs it. And from a menopause point of view, that can be very, very helpful. For men, from an erectile dysfunction point of view, besides checking those male hormones, check your thyroid out too. Certainly, medical illnesses can affect blood vessel and nerve health that have to do with this whole complex sexual response. Medications can interfere, alcohol, tobacco, street drug side effects, and mind body effects. If you're not feeling good about your relationship or you're worried about whether you're going to be able to get an erection and keep it, sometimes that'll interfere with that functioning. So what treatments are there for erectile dysfunction? Certainly the hormonal therapy when indicated. There are medications that increase nitric oxide. These are well-known, Viagra, Cialis, etc. There are injectable medicines that you can put into the penis with a teeny tiny needle right when you want an erection, and that will close those valves and let the blood flow become more stiff. There are vacuum pumps that you can buy over the counter and also prescription. There are surgeries with penile implants that a person can have done. And then, surprisingly, lifestyle changes can turn around blood vessel illnesses and often help with erectile functioning. I want to talk about a few of the common challenges that happen in these areas. Premature ejaculation, where a man is so sensitive that he isn't able to maintain an erection long enough to pleasure himself or his partner. It's common, 30 to 40% of men experience this at some time, so you're not alone if this is a challenge. If it's a recurring problem, there are things that can be done to help. There are just wearing a condom can reduce stimulation. There are specialized condoms that are made to reduce sensitivity. Foreplay to the partner before contact can make it a more fun experience for both. And there are prescription medications that can delay orgasm. It's a negative side effect for some, but if you have premature ejaculation, it can be just what you need. So that's the SSRI medications. And if you combine those with Viagra or Cialis, that can sometimes also be very helpful. There are behavioral techniques that you can learn if you're experiencing this, where you train your body to slow down. One is a pause and squeeze technique, and the other is a start-stop technique. And I've given a website here that gives you tremendous detailed instructions on what you can do to help with this. There's a lot about how our mind and our body interact, and particularly in this condition, there are things that can be very helpful. If you have a hard time reaching orgasm, look at your medications if you take any, particularly the Prozac, Lexapro, Celexa, Zoloft, SSRI group. This is a specific side effect. It's hard to get to orgasm. So you need extra stimulation. But you can also undo some of those side effects with these two natural medicines, ginkgo biloba or saffron. And I would say 75% of my patients get improvement with those natural medicines. If you are a woman and you have difficulty getting orgasm during lovemaking, don't feel alone, because it's very, very common for a woman to need extra and more stimulation than, say, a male partner. And the clitoris is physically located in different places in different women. And with intercourse, it's very accessible for some and not so accessible for others. So direct clitoral stimulation, either with your own or your partner's fingers, with vibrators, with oral stimulation, all of those things can make a big difference. And the whole issue of sexual toys, if you haven't ventured into this area, but you're experiencing challenges, I would encourage you to explore, because vibrator stimulation to the clitoris can make a huge difference. Knowing that taking partners or taking turns with your partner is normal can be helpful in terms of just feeling good about what your lovemaking experience was like. These are a couple of online resources for sexual toys. If you want privacy on your browsing, use DuckDuckGo. It won't send your name and address to every other sex vendor that's out there. So that's just a tip. Vaginismus is a condition that can affect women where there's an involuntary spasm or tensing of the vaginal opening when there's penetration that can be very uncomfortable. This can be related to previous trauma. Pelvic floor physical therapists are very good at helping with this. Vaginal dilator therapy can be valuable, and trauma-related counseling can be very helpful. And then relationship challenges, right? This is a reflection of your relationship in a bigger way. So there are a lot of things that can develop. And if you're shy about talking about them with your partner, it makes it especially hard. So I'm giving you a resource here that's a practice in Bloomington that focuses on the relationship and sex counseling. And they have a course online that you and your partner can take privately. And it's been just a lovely, lovely resource for a lot of my patients. And of course, they also do counseling with couples as well. And they do retreats that are not just sex, but relationship focused. So I have 10 minutes for questions. Surely somebody has a question or a comment. No? Yes. The question is it typical in older men to have lower sperm volume? So the semen, the fluid that comes out with orgasm in men, is a complicated mixture of secretions from the testicles, the prostate, the glands, the bulbocavernosus gland, and the volume varies a lot normally from one person to another. As a person gets older, yes, there can be a reduction in that, just as there can be a reduction in how firm an erection might be, but still very functional. So, good question. And you had a question? Yes, the handouts are on the table, just right as you come into this room. There's a table just at that corner. So I tried to save you from having to deal with all of these details. Our plan, we're live streaming our presentations on Facebook right now, and we're also recording so that we will be posting the presentations at our website in the future. So hopefully if you want to go back and review any of these slides, you'll have the opportunity to do so. Yes. So the question is, how much will weight loss help with the physical ability to have sex? So it depends partly on how much weight you're dealing with, right? If you have a pretty large belly, that starts getting in the way. You have to get a little more creative in terms of ways to be with your partner. And if you're having issues with too much estrogen, it's really big. Now, from a reversal of blood vessel hardening of the arteries, which is one of the things that affects the blood flow to the penis, we know that lifestyle changes can reverse those thickening and hardenings. So a plant-based, low-fat, whole foods diet, along with regular exercise, learning some focused relaxation techniques, those things have been proven over and over again to reverse coronary artery disease, reduce stroke risk, and often return potency for men who are challenged by that. So that is, I hope, a message of positive things that you can do to help yourself. So the question is it typical as a man gets older for the erection to be not as firm? and it is, but it's a combination of all of those things that I talked about, because as we get older, we have more issues with hormones, more issues with blood flow, more issues with nerve health, like in a man with diabetes. But our systems often need more stimulation as we get older. So yes, changes are common as a person gets older, but I don't accept that that's always a normal thing. Does that make sense?
That son became famous, and then all generations went forward. And then the story goes on later where after he had his son that he almost sacrificed, then at age 160, he marries his second wife and has like 7 more children. I mean, how is that? How can people even comprehend that that might actually happen? Or actually, people don't live that long, but I mean, how can that crazy story get in the Bible? You have a kid at 100 that starts all of Israel, and then at age 160, like there's a second wife.
Yeah, I've wondered about that too. So the question is, there is a biblical story where Abraham fathers Isaac when he's 100 and Sarah is 80. And then his son Isaac has children when he's as old as 160 in the biblical story. I've wondered if the ages, maybe there were lunar cycles or something as opposed to years, but I don't know how to explain that. Other than fertility in men lasts as long as they do. But as a man gets older, the opportunity for genetic problems to happen in the sperm increases. So when a much older man fathers a child, there's a little higher risk of genetic issues, just like there is when a woman gets older. But after menopause, unless you do some of the extraordinary other options that are now becoming available, a woman is no longer fertile. So that 80-year-old Sarah at birth, that's pretty amazing. Yes.
Always good for a woman in my situation, and other times that it can cause like organic issues, cancer. Can you briefly touch on that?
Yeah, so the question is, what about soy and menopause? And what's the story on risk versus benefit related to soy? That's a really good question. So for a lot of years, we know that soy is one of the foods that has what are called phytoestrogens in it. And that stimulates estrogen receptors. And there was a fear that that would also stimulate estrogen-related cancers. And so we knew, based on studies 20 years ago, that soy actually was a pretty good preventive for estrogen-related cancers. But once a woman got an estrogen-related cancer, we said, well, to be on the safe side, we're encouraging you to keep your estrogen low. We would stay away from those high phytoestrogen foods. However, in the last 15 years, there have been 4 really good studies trying to answer that question in regards to breast cancer. So the studies, 2 in the US, 2 in Asian countries, took a group of women who had more than local breast cancers and looked at what their soy intake was and how they did over a significant period of time. And what it showed was that the more soy you ate, the better you did. And so it's like it's a protective thing that gets in the estrogen receptor rather than stimulating it in increasing the risk of cancers. Now, I would say, though, that it's really important to buy organic soy, because right now with the GMO issues, we have Roundup poured on soy plants. And so if you buy organic, that won't be true. And so that's important. And soy does have a little bit of a goitrogen effect. So if you have borderline thyroid issues, you may want to avoid that. But it has so many positive aspects to it, as long as you're not sensitive, like with all foods, you can be. It's a wonderful protein in terms of plant-based proteins. And for midlife women, it is a great food. Personally, it's one of the things that I use that I have found to be very helpful. Edamame, which is the whole soybean, is a lovely snack and very unprocessed, but soy milk is a milk alternative when you're lactose intolerant or you're just looking for non-animal protein alternatives, because all animal proteins stimulate cancer. It's unfortunate but true. Then I think soy is a lovely resource. Tofu is a great thing that you can incorporate into your food. Yeah, great question. Thank you. So the question has to do, does sperm volume relate to fertility? And male fertility is a whole nother topic, but the semen has many aspects to it besides just the sperm that play a role in the ability for a man to be able to conceive a child or to participate in conceiving a child. So if a person wants to and things aren't going the way they'd like them to, then a semen analysis would be the thing that would be a way to analyze whether the sperm liquefies when it should and whether the sperm are healthy and whether they swim and move or not. So there's a lot of aspects. It's not just the number, but when the sperm count goes down, then that reduces the fertility as well. So I need to stop. If you have other questions, I'll be happy to try to address them for you later. I am looking for the person who is here to do the yoga. Okay. So our format for today's program, and we're so glad that you're here, is to provide you some informational presentations like I just did, and intersperse that with presentations that have to do with experiences. And so the person I would like to next introduce, tell me your full name, Libby Hendricks, who works with Common Ground, which is a lovely yoga studio here in Terre Haute.